Professor Obehi Akoria, who debunked fears that healthcare may not be accessible to the poor, explained that the Edo State government will explore all existing health policies and programs that take care of the poorest or the poor.
Why the movement? Infrastructural decay, structural decay. Where to? Lateral movement to the adjoining Edo Specialist Hospital. In this state, we have two big hospitals that are in the metropolis owned by the state that provide secondary level care. One of them is Edo Specialist Hospital. The other one is Stella Obasanjo Hospital, which we all know, down Sapele Road. The story of Stella Obasanjo Hospital changed in 2020 with the advent of COVID. There were a lot of uncertainties, a lot of COVID cases all over the place. We needed a central place owned by the state where COVID cases would be managed. So, Stella Obasanjo Hospital was repurposed to provide care for COVID patients. So right now, we have a section of the hospital with one part of it 12 beds, another part of it almost 30 beds, almost 50 beds on the whole available for the care of COVID patients. There's a lot of work going on right now to get us to have our hospital back, irrespective of COVID. Because what we are seeing now is COVID doesn't seem to be going away. So we have to tweak our healthcare system to work as it should, whether or not COVID stays or goes away. That's where we are. Quality healthcare has 6 domains, and one of them is access to care. And so that's why the priority in this conversation is access, and that's why it's a lateral movement. Central Hospital and Edo Specialist Hospital share the same space. They are just side by side. We are deliberately having this meeting in this place just to let you know that we're also thinking about access. You know how this place used to be before. The changes that have happened here happened within days. To be able to cater for patients who also need access. This is just down the road from Central Hospital. And there are several more like this being worked on to improve the question of access. By the time we are done, we are going to be in a better place than we were before, because the access to quality healthcare with people, well-trained staff manning the healthcare facilities will be even happening closer to where our people live. To the right there, you can see Dr. Humba. He's one of the doctors who used to provide care in the medical outpatients clinic in Central Hospital. Along with some nurses, they have been posted to other centers, and then others have been posted to strengthen other departments in Central Hospital. So that's how we have managed, and we are managing this transition.
The health commissioner declared that the decision to upgrade health care for the citizens necessitated a lateral phase movement of services from Central Hospital to Edo Specialist Hospital to ensure that disruption of services is minimized and make medical personnel to respond to the obvious challenges that may arise as quickly as possible.
And so what we have done, some of the staff who used to work in that structure have been moved into Edo Specialist Hospital to take care of the surge in attendance that we expect and which is already happening. Some have been redeployed within the part of Central Hospital that is not moving, which is on the opposite side, the pediatric, that's the child health department, and behind where we are talking about now, the obstetrics and gynecology department. And then the others have been deployed to 8 primary healthcare centers to provide the kind of care that they used to provide in Central Hospital, but in a different kind of ambience.
Clement Akasie, EBS TV News.